Hey there, folks. Thank you so much for joining our session. We're so glad to see your faces. We know that lunch took a little longer, everything took a little bit longer, so we want to get started just so we can make the best use of our time. My name is Christine Dolan. I work at UC Santa Barbara in the Resource Center for Sexual and Gender Diversity. It's our version of our LGBT center. I use they, them, theirs pronouns, and I just started working there this summer. I had worked for 3 years in St. Louis doing this work on a college campus, and before that on the East Coast. I'm going to pass the mic down as we all introduce ourselves.
Hello, everyone. So my name is Emmy Matsuno. I use she, her, or they, them gender pronouns. And I'm a fourth-year counseling psychology PhD student. And so my research focuses on transgender mental health. And I'm also part of the Santa Barbara Transgender Advocacy Network and the Trans Task Force on UCSB.
Emmy is our incoming vice president of the Santa Barbara Transgender Advocacy Network. And that organization was founded in Santa Barbara by me and Rachel Gloger to make sure that the organizations and institutions of Santa Barbara were treating transgender people right. It's not a clinical program, it's a program of public education and policy rewrites. I'm a medical social worker by training. My name is Max Rorty, and my pronouns are she, her, hers, and I'll be talking about medical issues specifically.
So just before we get started, we're going to talk about gender diversity and working with trans and genderqueer non-binary clients. Just to get a sense of who's in the room, who here works in a CAPS or Counseling Psychological Services office? Awesome. Who works in student health, like a student health center? Awesome. Who does student affairs work? There's overlap. Awesome. Anyone else in the space that wasn't accounted for? Yeah, what do you do? Awesome, that's great. Okay, this is great. Good group. Anyone else? Yeah. Oh, nice. Mental health needs for faculty and staff. That's great. Awesome. Okay, great. This is a good group. How many folks here have been through an LGBTQ training before? A safe zone training? Okay, a lot of folks. How many, this is your first time, never really had that exposure or that opportunity before? Handful of folks, great. So a couple things that we're going to do is we have a lot to cover today, and again, we're cut a little bit short based on time, but we're going to talk about some frameworks which will be covered a lot of the kind of safe zone basics around assigned sex, gender identity, and gender expression. We want to make sure that everybody has a common foundation around what those terms mean and what we're talking about when we're talking about transgender clients. Then we're going to talk about caring for bodies and what it looks like in the clinical and also in the counseling realms to support trans folks and to be trans competent. And we'll talk and we'll end with action steps and some interventions that you can take back to your campuses or back with your clients to make sure that you're more trans competent, if that makes sense. So since we have kind of a mixed group and a lot of folks who have had more exposure, we're going to be looking to you all to make sure that you're kind of nodding along with us as you go. And we'll move through things quickly if you're all clear on that. We don't want to waste your time. But if there are any questions, please feel free to shoot up your hand and toss things out there, especially for clarification. Like I said, we have a lot of ground to cover, but we want to make sure things are clear, and it's a safe space for questions. So without further ado, I'll get started. Just to talk a little bit about terminology and concepts. When we think about gender and what gender means, right? A lot of us, kind of the exposure we have are the popsicle people on restroom signs. But really what it is it's an unraveling, right? There's so much more to it. It's not a binary and it's complex, right? And it's very self-defined. And yet, this is kind of our exposure, right? As we're socialized in gender, right? The conversation around what gender looks like when someone becomes pregnant and is expecting, right? And we kind of go to this place of, is it a boy, is it a girl? Gender reveal parties, I just tried to find the most ridiculous things that I could on online. So, it doesn't take long to find things like this. Strangely, right? But because of that, this is the way that we're socialized, right? Not just in this binary space, but also with this very oversimplified way of blue and pink, right? Male and female, boys and girls, men and women. Does that make sense? So with that said, I want to talk a little bit about these kind of distinct concepts. Assigned sex is the first one. This idea that, like I said before, people will say oftentimes it's a boy, it's a girl, but really, when we're thinking about assigned sex, we're thinking about things like hormone levels, chromosomes, and our body parts, right? A lot of times it's kind of more medically defined, or it's at least assigned at birth. And this idea of, I've never had a chromosome test before, I've never had a hormone level test before, and when I joke with people all the time that when I was born, a doctor looked at me and said, it's a girl, but really probably meant this looks like a female body to me, right? So this idea of it's a boy and it's a girl is coming from what we know, which oftentimes is assigned sex, and we think of it biologically, right? But we also know that it's more complex than that, right? That there's more than two sexes, and that it's very complicated, right? So this idea that there are female assigned bodies and male assigned bodies, right? And that those are really our two legal sexes in this country, right? That there are, on our paperwork, right, on my birth certificate and things like that, it says male or it says female. And at the same time, we know that there are intersex bodies, right? So whether that's a set of chromosomes or hormones or body parts that are different than expected for male and female bodies, intersex bodies exist as well, right? And one thing that I like to say, and this is not scientific data, but there are, someone told me once that there are as many intersex people as there are redheaded people naturally, right? And so it's a very common natural occurrence, and the fact that we've reduced our biology to two sets of sexes is not necessarily because there are only two, right? It's just the way that we understand it. We also know that there are societies and cultures and countries that recognize more than two sexes on their legal documents as well, right? So understanding that sex is not a binary, that it's about primary sex characteristics, also about secondary sex characteristics. Even our height, the tone of our voice, the amount of hair on our bodies, that all kind of connects to our biology, right? And I'm not saying it's very interesting to think about how male or how female a body might be based on their height, but it does prove that there's more gradient to it than we think, right? So when I talked about intersex bodies, it's also good to know that they exist in many different types of species and different types of animals, and that they're very naturally occurring, right? Awesome. So gender identity is something I think that we, again, when we say it's a boy, it's a girl, those are the terms that we use when we're talking about gender identity. Women and men, the kind of assumption that folks who are assigned female at birth are going to grow up, be girls, grow up to be women, right? And that we'll refer to them as she, her, and hers, right? This idea of this kind of internal sense of who we are, our sense of self, right? It's not about our bodies, our gender identities, right? Which is why it's problematic to say things like it's a girl and it's a boy, if that makes sense, based on this framework. People tend to become more aware of their gender identities as they're young and throughout their lifetimes, right? And that can shift over time for folks where it's fluid, right? And it's defined by ourselves. We're also kind of socialized in this idea of gender, right? And that shows up through gender expression. But it's good to know that there's more than two gender identities, as we all know at this point, right? That a lot of folks may identify as trans in a binary way or in a non-binary way, right? And that there are words like genderqueer, gender fluid, gender nonconforming, terms that exist outside of that binary to define folks. And so with that said, too, I think it's important to recognize that gender is also very cultural, right? That in different countries and in different cultures, gender exists. We know that in native cultures here, there are more than two genders. There are two-spirit people. In India, Hijra folk exist outside of that binary. And across the world, right? And so it's important to know that, that even the way that we're framing gender identity and talking about it here, and even in your term sheets that you all have, right, a lot of those terms are very much US-centric, right? And that there are ways that your clients are going to identify outside of that framework as well. But gender expression is more about kind of the messages that we're sending out to the world about our gender, right? This idea of masculinity and femininity and the way that we're perceiving folks oftentimes is our interpretation of someone's gender expression, right? And I often like to say too that gender perception can be pretty different from gender expression sometimes, right? The way that we're experiencing someone's expression isn't necessarily the way they're intending it, right? But this idea of femininity and masculinity, again, that assigned female bodies are assumed to be girls and women, and then also assumed to be feminine, right? And the same on this other binary side, assigned male bodies are assumed to be men, grow up from boys to men, and be masculine boys to men. Okay, and had to say it. So, just the best. So this idea of gender expression being defined by things like hairstyle, your clothing, makeup, whatever that might look like, right? Speech, body language, even personality traits based on kind of common gender roles and the way that we understand gender expression, right? But something that I think is really important too is that this is very contextual, it's very cultural, right? And it shifts over the course of my life. And for me, I mean, I don't know about you, but my gender expression is very different when I'm on the couch, at home, when I'm at work, when I'm on a fancy date, when I'm at the gym, right? So gender expression can look very different as well, and it can be very much a bracket. And I'll share more about my gender expression later. But this idea, too, that it kind of gives to this concept of gender roles, right? For folks who can't read it, in the top left here, it says, boys are football players, boys are pilots, girls are cheerleaders, girls are stewardesses, right? So that's something that we're all taught, right? That's a thing that's real and not, right? But does anybody know who this person is in the middle? This black and white photo. Anybody recognize that person? Someone say that's a president. Yes, Teddy Roosevelt, right? Yeah, that is Teddy Roosevelt. And so something that photo kind of illustrates is that even masculinity and femininity have been interpreted very differently over the course of time, culturally, et cetera, right? And so to think that, a masculine man-identified person, and that was kind of a performance and an expression of masculinity back then. Does that make sense? So that's a portrait of a young boy, right? And I think now many of us would perceive that might be a portrait of a young girl, right? Again, not in any way looking to call out Teddy Roosevelt, but I do think that we have to understand that this shifts over time, right? And that can really change. Stereotypically, pink, is very much this like feminine color. Blue is very masculine, but back in the day, whatever that means, pink was a very masculine color. It was representing kind of like red and blood and war and things like that, right? In many centuries ago in Iraq and Iran, men wore high heels because they rode on horses and they were taller in order to be more masculine, right? So this idea of masculinity and femininity shifts quite a bit, and it kind of gets pushed into this idea of gender roles, right? Expecting people to kind of perform masculinity and femininity in certain ways and being pushed into boxes. So at this point, I want to take a moment to have a discussion. If you could turn to a neighbor or partner, someone with you at your table, someone you know or don't, and talk a little bit about a time where you experienced a gender role growing up or recently, whatever that might look like, and what that was like, when you felt limited by that, when you were experiencing some stereotypes, and what happened, and what did you do? So if you could just take a moment to talk about that would be great. Hey all, if I could ask you to please bring your attention back. Thank you so much for having good conversations. I know gender can be a bit of an unraveling and unlearning process, a remembering. How many folks, when this came up, was it like not really that hard for you to think of something that limited you, that you experienced a stereotype? How many folks was like, ooh, this is really tough, I don't know? Yeah, a handful. It seems like this tends to bring people. It tends to bring things up for people, oh my goodness, and really be able to kind of jog those memories, right? And even if it's not something specific, sometimes people have that kind of very visceral reaction. And even for folks who, we'll get to this, identify as cisgender, or even folks who identify as cisgender men who don't experience sexism in the same way that women or feminine identified folk might, right? There still are ways that we're kind of limited by these gender roles, and it can be a very visceral experience. So something I want to do is just bring this all home, right? This idea of these spectra. And I need as many hands as I can for this. So this idea of assigned sex, gender identity, and gender expression being different, right? We talked about that and what all of those mean. Sex, again, being more about how we were assigned at birth when a doctor or someone looked at our bodies and said, this looks like a female body to me, for me, right? And then how that kind of the assumption was that all of these would quote unquote line up, right? That there would be, that there are only two options, right? That there's no lines between these, that there are only two options, and that all of these things would line up for folks. Does that make sense? That's kind of the heterosexual cisgender normative assumption here, right? So if someone were assigned female at birth, grew up to be a woman, identifies as a woman, is like, this works, this fits really well, maybe even experiences femininity in a certain way, feels like this really fits well for me, that person would identify as cisgender. That's just what that term means, right? And same thing over here. If someone was assigned male at birth and grew up to be a man, feels like this works great, boys to men, right? Masculinities feels good, or whatever that looks like, that person would be a cisgender man, right? And so what I want to do here is kind of quote unquote plot myself a little bit. You'll see in this top one that it is a spectrum, but the checkboxes exist really to say that still legally we're only recognizing two sexes, right? So that's kind of where that exists. There's a lot of different ways to kind of think about this and conceptualize this. But for myself, what I would say is that when I was born, the doctor should have said this looks like a female body to me, and that's what I was assigned. So up there, right? In terms of gender identity, I identify as non-binary and also as genderqueer, and kind of outside of that space, right? I could plot myself in the middle somewhere here in this line, but truthfully, if I could use a big permanent marker, I wouldn't. I would put it probably more up in the middle, right? I'm too short. But this idea that if man were red and woman were blue, my gender identity wouldn't be purple, it would be yellow, right? It's kind of a separate space outside of those concepts, and that my identity isn't necessarily anchored between those 2 points. Does that make sense to people, kind of, sort of? Okay. Gender expression is a little bit more in this range, right? This idea of at the gym, on a fancy date, on the couch, right? It's very scientific, probably from here to here or whatever, right? I think something I want to say about this, a couple things really briefly. Over the course of my life, I've definitely lived over here. And actually more recently, more and more with growing my hair out. I'm just doing the curls and seeing where it takes me, and it's really fun. But it's really fun. But I used to rock the eyeliner, and my mom pierced my ears when I was 2 days old. And so I have kind of lived all along this line. Also, I think too, because more often than not, people would probably expect me over here, I get pushed into masculinity more because people are very used to binary. It's more comfortable to push people into that space. Does that make sense? I think sometimes for some folks, and I don't even mean specific people, but just the way we're socialized, all it takes is for someone to see me in a bow tie, and the next day they're like, where's your bow tie? Where's your bow tie? Where's your bow tie? They just expect this from me all the time, right? And I'm like, that's interesting. I also think too, because I would plot myself here-ish, a lot of folks expect that I am a lesbian, that I'm attracted to women, for example. If we had a attraction to and women were over here, a lot of people would plot me here, and they'd be correct. I am attracted to women, but I'm also attracted to men, and I identify as bisexual. Most people are surprised to know that my partner's a man. So I think too, as we're talking about gender, right, I don't want to compare or conflate that with sexual orientation. It's different. But what kinds of assumptions are we making? Oftentimes entering through this line. Right? We think we know things, and we may know things about people. They may tell us this is who I am. But if we don't, right, we're oftentimes taught and socialized to enter through this line. Does that make sense? And even just what our interpretation of what this line is. Does that work? So one thing I will say is that, like I said, cisgender is when these things quote unquote line up for people. As someone who does not line up, I identify as trans and also as non-binary. So that trans means to cross, cis means on the same side. Cis-alpine is a word, if anybody's wondering, it's on the same side of a mountain. Cis on the same side, trans to cross. So for me, as someone who is assigned female and identifies as non-binary, that fits. Not all non-binary people identify as trans, but for me that does work. Do you all want to plot yourselves briefly? Yeah.
All right, so when I was born, so I was assigned female, and I would say that my gender identity would be somewhere in here, in this range. But my gender expression tends to be over here. So I would identify myself as a gender non-conforming person because there's a cross between my gender identity and my gender expression. But like Christine, my gender expression is very fluid and it's changed over time. So in the 7th grade, my favorite color was pink. I had long hair, I wore makeup, and so now to put on a dress, I would feel super awkward. But there's certain times where I like to have a very masculine gender presentation, but I also feel like I have a lot of feminine qualities about myself and my personality and just different ways of being, and so, sometimes I'm more in this gender expression. So that's me.
My name is Max. My family looked at me when I was born and said it's a girl. So I'm a female assigned at birth person. My gender identity has always been girl. I've always wanted people to know that I am a girl and now that I'm a woman. And my gender expression is, to me, very femme. I am a femme-identified lesbian. I am as girly as I can possibly be. I love a dress. I love some nice boots. My hair is really short because I'm a medical professional, and fingernails are gross, and hair is gross, and hair is just gross. And sorry for all you hair lovers out there. And my name is Max because I was a drummer in college, and we only played Bruce Springsteen songs. And so we were Bruce and Max Weinberg, and that's where I got my name 20 years ago. And so it's gay, and it's maybe a little butch, but I don't feel butch. I feel femme. And so there's a lot of parts of me that are femme identified that you may not be able to tell immediately because I look like I'm an angry lesbian, which I also am. And so just to clarify, all up and down this row, I'm like girl, 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 all the sides, and that makes me a cisgender woman.
Thank you all so much. Like snaps or claps for people putting themselves out there. Thank you all so much. I think it's really helpful for folks to plot themselves when we're training people whenever we can. Please don't ask your clients to plot themselves. Please don't ask anyone in your life to plot themselves unless they really want to. But I think when we're demonstrating things, it's helpful because it just shows that you may be reading something here and it may be a different interpretation for that person, right? What we're interpreting about gender expression isn't necessarily the intent, right? So asking questions and getting to know someone and connecting really helps. Another person I just want to plot really quickly is Laverne Cox. I know we're going to get to that in just a moment, but do folks know who Laverne Cox is? Sort of, kind of, yeah. So Laverne Cox, we're going to talk about her. She's a trans. She's very open about being a transgender woman specifically. She speaks about her identity. She had a show called The T Word on MTV. She was on Orange is the New Black, a trans woman playing an actual trans woman on TV. Imagine. Amazing, finally, geez, oh my gosh. Okay, so Laverne Cox, we will show a picture of her in a little bit and we'll talk more about her. But she was assigned male at birth, and I'll get back to that in just a moment. She identifies as a woman, like I said, so that piece around trans to cross, does that make sense? She identifies as a woman, and she's probably very feminine, even at the gym. I imagine she is all cute up at the gym. But I just want to share that piece. We're going to talk a little bit more about transition later, so I would not plot her as male. Personally, not only because she has undergone some medical transition pieces and we don't know what her body and biology looks like. More realistically, though, I would personally plot her as female. I don't know what her legal documents look like. I'm not asking her about that. That doesn't matter to me. But for someone who identifies as a trans woman, again, to cross, yes, absolutely, assigned male at birth. She may say to me, hey, Christine, you know, honestly, I am a woman. I live in a female body. That's who I am. I am female. And I go, you right, Laverne. Of course you know best. You know what I'm saying? So with that said, with trans people, I think it's important to understand assigned sex. It's important to understand how it's different from gender identity, but we can't separate it too much. Because when we separate it too much and continue to tell, for example, trans women that they have male bodies, trans women that they're male, that can very much negate their experience. Does that sort of kind of make sense? So see how we kind of like pulled it all apart and then put it all back together? It's still really complex, right? But it's just about getting comfortable with the complexity. Okay, I'm gonna keep moving unless there are any questions. Please feel free to shoot up your hand if you have any questions at all. So this idea of transgender, like I said, is folks who kind of cross, right, along those lines. Think of those very imperfect, very non-scientific spectra that we just showed you on the previous slide, right, to cross. It's oftentimes different. It's this idea of someone identifying differently than they were expected to based on their assigned sex. And cisgender, like I shared earlier, which is when those things quote unquote line up, right? The expectation that someone will be cisgender, which is just how we're socialized. We're not bad people, we're just socialized to expect folks who were born and assigned female at birth to grow up to be women. If that's true for you, if someone is not transgender, someone is cisgender. Does that make sense? And so again, this idea of assigned sex connecting to this expected gender identity being cisgender. So some examples of different ways that folks identify. Trans women, Laverne Cox is here. Does anyone know the rest of the folks up here? Shout them out if you know it. Gina Rosero, right? Carmen Carrera, and the other one is Laura Jane Grace. I get the three names confused, but they're amazing. She's an amazing singer and part of a band. All three of these folks are out transgender women, trans women, and also women. Again, folks who are assigned male at birth, but we don't know what is on their legal documents. You know, we put this up there only to illustrate that that's what the concept is, but please don't cling to the fact that these people are male, right? Because that really, again, otherizes and pushes them away from the identity in which they identify with. Does that make sense? Again, some of their legal documents may say female, some of them may not, but really, you know, creating space for folks to self-identify and also recognizing that all of these women are very kind of feminine, but that trans women aren't necessarily all feminine, right? More examples, Laverne again, she, her, hers, and Janet Mock. Anybody heard of Janet? She's really cool. She has a really great book called Redefining Realness. Read it, it's so good. And so these are two other really amazing trans women, specifically trans women of color, who've gotten more visibility. These are some examples of trans men. Anybody know these folks? Chaz, we all know Chaz Bono, good people, right here. Anybody else? I know the person on the left is Shane Ortega, right? Who was out trans man in the military, trans man of color. Who are the other two?
On the right, it's Lucas Silveira, and he was named Canada's Hottest Man 2010. Whoop whoop.
And then the person in the middle with the men's health is Aiden Dowling. So these are trans men, again, assigned female at birth, but please, again, do not cling to this. We don't know what's on their official documents. Not all trans men have female on their student records, for example, or their student health records, right? So know that that may look differently for everyone. You may see that a lot of these are kind of very normative bodies, right? The way that we expect men to show up, right? And so this idea of passing and passing politics is kind of very much present in binary trans people's lives and that expectation of what that looks like. And a lot of your clients may not A, have access to that, or B, be interested in that, right? So just keep that in mind. Two other folks who identify, well, Chaz was there before, but we just love him so much. And then Kai Allams, who is an out trans man of color who was also, I believe, the first ever trans person to play in the NCAA. I believe he was at George Washington in basketball. And so he's really amazing. He's a great speaker, too, if you need a speaker at your campus. Non-binary folks, we're going to talk, we have some examples as well, but we talked about this a bit earlier too, right? This idea of falling outside of the binary. Some of those folks identify as trans, some don't, and this idea of either bigender may be someone who identifies as both man and woman and kind of moves between those spaces, right? Agender, someone who doesn't identify with a gender or may say, I don't have a gender, right? Fluid, creative, defiant, these spaces outside of that space, right? This idea of it being very fluid conceptually and may change over time or may change based on context, right? Folks who are questioning, folks who identify just kind of outside of that space, like I said in my example, genderqueer, just being a separate space, yellow instead of purple, right? So we know that non-binary folks exist, and especially when we talked about our students, quite a few students, more and more are self-identifying as non-binary because there's more visibility, right? There's more space created for folks more recently. So here are two famous people, Ruby Rose and Angel Hayes. Both identify as non-binary. Ruby uses she, her pronouns, identifies as gender fluid, and Angel Hayes uses they, them pronouns and identifies as agender. And then we have gender nonconforming folks and students, and as Emmy shared, who identifies as gender nonconforming, that could look like someone who identifies as cisgender or as transgender, but oftentimes it's more about gender expression, not fitting an expected gender, if that makes sense, gender identity, and not so much about the gender identity itself, right? And so, for example, Eddie Izzard, who talks a lot about being a quote-unquote a bloke in a dress, direct words, right? This idea of, no, like, I am a man and I wear dresses. It's my gender expression, it's not my gender identity. Does that make sense? Rachel Maddow. Sorry. Sorry, just make sure you're all awake. Rachel Maddow is wonderful and is a famous news anchor and reporter and Rhodes Scholar, and I just want her to marry me, but she's great, and she's gender nonconforming as well. So again, this is kind of brings us back to this space of how these are all separate. This is also a really reductive way of thinking about it, right? How do we really define agender on this, right? We don't, right? Does someone plotting themselves here in the masculine territory really make them less feminine? It shouldn't, right? This isn't even a very imperfect tool, but it illustrates that there's so much more than two. And this idea that they're not the same, right? We can't conflate them, and that we can't make an assumption based on one for the others. Does that make sense? Also, I think we're not going to talk a lot about sexual orientation today because we really want to focus on gender and trans clients, but folks have sexual orientations, right? Even if they're asexual, right? And so this idea that trans folk can have any sexual orientation, bisexual, queer, straight, heterosexual, whatever that looks like, and that may shift based on gender or may not. It's very different for different people, right? And so remembering that transgender is not about sexual orientation and that it is not a sexual orientation, right? It's not about who I'm attracted to or who I find attractive, right? That is a separate piece to who I am, right? That my gender identity and my self-concept is about being transgender, and that sexual orientation is about who I'm attracted to. Make sense? Sort of, kind of, following along? So yeah, how do we know a trans person's sexual orientation? We don't. We can't make assumptions, right? And there isn't necessarily a normative way of understanding that, right? I know tons of people who are transgender, some of which explore their sexual orientation after transition, whatever that looks like, social or medical, and we'll talk about that. Some of which don't. Some of that may look like, oh, I was before identifying as a trans man, I identified as a lesbian, that shifted and now identifies as a straight man. That person may still identify as a lesbian even though they're a trans man. That can really look 100,000 different ways. So recognizing that people are going to be able to define their own sexuality and identity, and that we have to just ask and explore that. And as medical practitioners and counselors, there is no expectation for your clients about, oh, so this is about your sexual orientation so that it can match up, so that you can now be a heterosexual man. No, that's not what this is, right? It's really different, and you're going to experience that very differently for clients. I think that's all I've got, right? So transition. This is transition to transition. Yeah.
So we're going to make a transition here from one speaker to another. Questions as we make this transition? One, please.
Yes, and maybe the answer is different for everybody, but is there ever a point where they're not a trans man or trans woman?
All the time. Yeah, every time. The reason that we use trans is when we're trying to make clear to medical professionals that this person is an ovary-bodied man or a testicle-bodied woman. So trans is an adjective that we use to describe people. A trans woman, just like we say congresswoman. This is a person about whose history we need to know something, specifically if we're caring for their anatomy. But trans woman is as relevant as Indiana woman is. It matters only in the areas that it matters. Thanks for asking. Other questions? Please.
I think maybe you're going to get to this, but you commented about not asking your clients to plot themselves. But I noticed the intake form that was in our packet almost seems like sort of plotting a source script. I'm wondering if we're going to talk about that later.
Do you want to speak to the plotting question?
Well, the only reason that I said don't ask people to plot themselves is because it can be very reductive and it's obviously not scientific. And also it should be a little bit more organic than that, right? Getting to know someone and connecting with them. In terms of the intake form though, I do think that if those intake forms are already asking questions like sex or things like that, and they're asking them incorrectly, there's more harm done than good by asking them incorrectly. So those are examples of what do you really need to know, right? And get a sense of what that is and ask it in the correct way on your intake form so that you're not asking a trans man, for example, to pick male or female when they're like, well, what are you trying to figure out from me? What do you need? Does that make sense? And Emmy's going to talk more about the intake form a little later, so I appreciate that. Yeah, does that help?
That's a good question. Other questions? Okay. I just want to act out one of the distinctions that Christine was describing because I think it's an important one to take away in our own experiences of ourselves as perhaps you are also an angry lesbian like me, and perhaps you are a gay identified person and that's a primary identity for you. We're not talking about gay identities in this presentation because our experience is that gender is a very much more primary identity and that gay or straight follows our gender identity. So to demonstrate this, I want you to visualize here next to me a very small but very fierce masculine woman named Kate, who I am married to. And she is butch identified lesbian. She likes to wear tuxedos when we get married. And she identifies as a woman. Her pronouns are she, her, hers. We're both fierce gay people in our lives. And if at any moment she decided that she wanted to transition to masculinity, if she decided that she was in fact he, Kate became Cato, I would become a straight woman at that moment. And she would become a straight man. So Christine points out that these things are subject to discussion. We could decide that we are queer people, for example, so that we didn't lose some of the community that we've developed over our lifetimes. But in terms of affirming our gender identities, in terms of my affirming my spouse's gender identity, it would be an important part of my, my belief and support in his experience to acknowledge that he is a straight person who loves me and I am a straight person who loves him. Does that make sense? So this is just a piece in terms of when we talk about identities and how tightly we hold them, that sometimes the thing that we are holding even more tightly just below that identity is our gender identity. And that our gender identity determines a lot of things about us.
How would you describe your gender if you were in a pan relationship with a lesbian woman?
So pan relationships are about orientation. And so the question is, who are the actors in that relationship? They are multiple, and they have maybe multiple gender identities. So some of our categories of people don't fit into gay or straight concepts. For example, an agender person what was the name of our agender example? Angel? So Angel doesn't identify as male or female. And so if Angel is in a relationship with a male person, is Angel straight? No. If Angel is in a relationship with a female person, is Angel gay? No. Angel is not defined by these labels because these labels are predicated on ideas of binary gender. So we have to kind of move past it as pansexuality already has. How we doing? World rocked? Super. We're going to talk about transition. I try to focus on this subject because it's a big part of the basic fundamental misbeliefs and misunderstandings about trans people. That trans people are, that transition is a surgical project, that surgery is something devoutly to be wished by all people, by all ovary-bodied men and all testicle-bodied women, that surgery is their end-all, be-all of their happiness, and as mental health practitioners, it's our job to get them to that place. So I'd like to debunk all of that nonsense and say that transition looks much more simple than that, much less surgical than that, and we'll talk about some examples of that. So here is the most common question that trans people get, and when we say this, this question is the most common one, we actually include the category of transgender children. So children who identify as trans at the ages of 3 or 4 are often asked about surgery on their anatomy, which, what? No. So surgery is an extremely expensive project. It's not covered by insurance, and it's not well supervised by the medical institutions, right? There's 2 or 3 people in this country who perform vaginoplasties for trans women. Nobody is, there's no review board of her work. They're doing these things as solo practitioners and getting paid privately. And this is even more the case in phalloplasties for trans men. There's, I think, 1 person in the country who's doing that kind of work. And there's not a lot of information in medical journals about the kind of work that's being done, and there's no insurance coverage, and there are considerable recovery times to these projects. So these things are available to people if they have $100,000 and a couple of months to recover without working. But asking somebody if they have had the surgery is a class-based question. It is reasonable to assume that of transgender populations, 1% of transgender men have had phalloplasty because this is a 1% financial option. The 99% do not have this chance. So this is Caitlyn Jenner's social transition. At the time of this photograph and the time of this tweet, Caitlyn had not had what's referred to as bottom surgery, but this money that she had access to, being a member of the 1%, she used for facial feminization surgery. And I think this is an important point because when we talk about what trans people need from us as cis people and as colleagues and as clinicians, trans people need to be seen as the gender that they are, and that is a face project or a name project or a pronoun project, much more than it's a pants project. This is Caitlyn saying, welcome to the world. Caitlyn, can't wait for you to get to know her. And a social transition is these 2 things, a name and a pronoun. So if you're transitioning across the binary, this is the extent of the transition. Previously you called me this name, but now this name. Previously you called me this pronoun, but here's the new pronoun. And that's a transition. Questions about that? So here are some kiddos. We're going to talk first about this person wearing the pink tie, looking pretty miserable. This person was named Mia when they were born, and right away they wanted very much to be called something else. They did not care for the girls' clothing that their parents put them in. The parents looked at this child and said, "It's a girl," and tried very hard to get Mia to agree to that project. And when Mia was 3, Mia just stopped talking about this subject, and then stopped talking about anything at all, and then started insisting on wearing the one non-pink sweater that they were permitted access to. So their entire family had nothing but girl children assigned at birth, and so Mia's clothing choices were very limited, and they were very feminine choices. But at some point, somebody got Mia a dog sweater that had blue on it and a dog on it, and Mia wore that sweater for a year. And at some point in that year, just started barking instead of talking to people. Her family, Mia's family, finally agreed that they would call Mia Micah when they were at home, and that Micah would be permitted at home to wear this tie. Isn't that the saddest little gesture towards masculinity you've ever seen? And that haircut is just like not quite, you know, it's just not it. And then they realized that Micah was never going to make it in preschool if they didn't start talking again, and did some research on the internet, thank God, and found some transgender families and realized that there was a way that you could just give Micah what they wanted, which was they wanted to have a name that they could use all the time. And that name is Jacob. So Jacob is a happy kindergartner at this time, and is talking very clearly about his joyful life. So Jacob is a trans boy, and this should be clear at this point, but just to make again the point that gender and identity is separate from sexual orientation. Jacob doesn't have a sexual orientation. This is not a sexual project. This is not a project of affectional relation. This is Jacob being Jacob. So let's talk a little bit about what it's like for Jacob to be an ovary-bodied person. At this time in his life, he does not have any medical interventions. He doesn't require any medical interventions. He requires the male pronoun he, the name Jacob, and access to a boys' bathroom. That is Jacob's transition. At some point in Jacob's life, at what age, like tell me people, what age now do ovary-bodied people develop breasts? 11. That's going to happen to Jacob unless his family can forestall that possibility by putting him on hormone blockers. Hormone blockers are readily available to all people. If you have any friends who have had either prostate cancer or ovarian cancer or breast cancer, hormone blockers are prescribed routinely to them as a way of stalling their cancer in its tracks. Hormone blockers are available to trans youth, and they'll be available to Jacob just as soon as his family decides that it's best for him to have them, right around the time he gets breast buds, and then those can be squished back in with hormone blockers. When should Jacob start testosterone? When will Jacob's cohort go through puberty? 13? So all around Jacob, 13-year-old boys will start shooting up, right? And they'll get huge and hairy and deep-voiced and gangly and start bonking into things. And so when should Jacob start doing those things? 14, 15, 16, 17, 18? If it were 18, that would be bad, right? Because Jacob would be this tall still, not having gone through puberty. So we need to make sure that medical professionals are trained in how to give testosterone to Jacob at a time that's appropriate for Jacob's peer cohort. 13? And then Jacob will go through puberty like everybody else, and he'll get gigantic and gangly, and he'll get facial hair, and he'll start bonking into things. And he probably won't get a period, which is probably great for Jacob. At some point after he turns 18, he may be interested in having surgery, but he may not, because who cares? Because he's not having a period and because nobody's paying much attention to those parts and nobody's questioned his identity since he was in the first day of pre-K. So also, does Jacob want to have kids sometime? We'll talk about that in a little bit. Just to reify, no medical interventions for people Jacob's age. Medical interventions start around puberty as an effort to make sure that we go through the right kind of puberty for our identities. Jazz Jennings. So Jazz is a trans girl. When her family saw her when she was born, they said, "It's a boy." And as soon as Jazz saw a pink thing or a purple thing or a sparkly thing, she put it right on her head. And that was when she was 2 or 3. And she is now, I think, almost an adult at this point. Jazz is a prostate-bodied girl, and she hit adolescence. Her family was able to get her access to blockers that kept her from becoming a 6-foot-tall prostate-bodied teenager, that kept her from developing facial hair, that kept her feet from becoming horrifyingly enormous, that kept her facial structure from becoming prominent brow ridge or wider jaw. And all of those things are really great for Jazz because we police women's appearance very intensely in this culture. And there's a lot of ways in which we think that people are unfeminine because we have an extremely narrow eye of the needle through which femininity, through which womanhood is allowed to appear. So you can't be too tall, you can't be, you could never be too short, can't be too strong, you can't be too fond of pants, you have to love hair. So Jazz has been on blockers and now she's on cross-sex hormones, and that means that she's been able to go through the puberty that she wants to have, which means that she's developed the breasts that Jacob, thank God, didn't have to develop. And that's how Jazz's medical history has worked out. When she turns 18, she can opt to have surgery if she has access, again, to all the money that requires. This is Bianca and Nick Bowser. They are a straight couple. They are a trans couple, and they are parents. Bianca is a trans woman, and her sperm was used to grow this baby inside Nick's uterus. This is one of their sons, they have 2, is a lovely, cute, adorable example of why it's possible you wouldn't want to have sex affirmation surgery at any time, because you might want to use those parts for baby making. Questions about that? That's a great question. That is something that is covered by insurance, and insurance companies, because it's a routine medication approved by the FDA for cancer treatments, et cetera, it is theoretically approved by insurance companies, and in practice, a terrible fight. Our friend and colleague, Joe Olson-Kennedy, is working on this project at the LA Gender Center hourly. And the work that she has to do to explain to insurance companies why this is best for physical safety of trans children it's endless. And she's successful, but we have some contacts to help you with that project. Thanks for asking. Other questions about kids and transition? Okay. So here's the thing that this reproductive endocrinologist needs. The person who helped this couple have babies has to make sure that their paperwork doesn't say man form for people who are depositing sperm. They need to have a form that says sperm deposit form. because you never know who's coming to deposit sperm. Similarly, if you are coming for fertility care, you should make sure that your forms don't say, women's clinic, or all of your gowns have bunny rabbits and pink things on them, because all kinds of people need reproductive care. Yeah. Everybody with me? Thanks for your nods. So similarly, and this is my favorite part of the presentation, we've been talking about how there's no relationship between the anatomy that we have and the clothes that we wear and the people that we want to sleep with. But here's the even most exciting part. There's no relationship between these things and how we have sex. And this is important for the medical professionals in the room, because we don't want to make assumptions about what we're screening people for when we talk about their health care. If we are working with a trans man and we say, well, this person is a man, and he's quite clearly wearing suspenders, therefore I will assume that he is the man in his relationship, if you know what I mean. And then we won't screen him for the possibility of pregnancy, the possibility of acquired STDs, because we will imagine that this person is the top in his relationship, but in fact there's no relationship between our parts and the kind of ways that we have sex. People, bottoms of all kind, are more susceptible to STDs than tops, and it's important to remember that the category of top or bottom is separate from the category of prostate-bodied people or ovary-bodied people, which is separate from the category of people who identify as male or female. Is that baffling? This is an important intervention to remember, because we often overlook the needs of our patients when we make assumptions about what we think that they're doing with their parts. So this is a very standard question for people in medicine, especially infectious disease, and we think of it as very progressive and illuminating. And I have a lot of cis hetero doctors who say, oh, I ask all my patients. And they do, and it's admirable. It's a universal precaution. Unfortunately, the question, do you have sex with men, women, or both, doesn't actually answer the thing that we as medical professionals need to know. What we are asking is, what is the gender identity of the person that you are having sex with? So if I say to my doctor, I'm having sex with a man, and I mean Chaz Bono, then my doctor will appropriately, knowing that I'm an ovary-bodied woman, will say, oh, you're having sex with a man, are you? What is your birth control method? And then I will say, birth control method? Has she not met Chaz Bono? This is absurd. What my doctor wants to know is, am I being penetrated? Where am I being penetrated? Who is penetrating me? And with what are they penetrating me? These are the things that my doctor needs to know to make sure that my parts are safe and that my reproductive system is protected. So the questions that we ask as providers are important. And this question, while seeming open-hearted and illuminating, is in fact obscuring of the thing that we're trying to ascertain. So without necessarily asking you or insisting that you tell people that your first question is going to be, who is penetrating you? Who are you penetrating? Where are you penetrating them? With what are you penetrating them? I won't make you ask that question, but consider what it is you're trying to ascertain when you're asking health-related questions of all of your clients. And that's my summary. Don't ask people if they've had surgery. That is a rude financial question. Our friend Red Durkin has a YouTube video in which he says, no, I haven't had the surgery, and I also haven't bought a baseball team. Do not imagine that children's medical stuff is appropriate conversation. It is not ever. The things that it's safe to assume is that most people haven't had surgery. Children absolutely haven't had surgery. And so, again, only medical professionals need to know this information, but it's safe to assume that people haven't had surgery, and as a consequence, they are perhaps very scared of medical professionals. So let's be clear about what we need to know, how we need to know it, and make sure that our questions are protective rather than prurient. That's it. That's a really great question. It absolutely is true, and there are no doctors that take it. So you can find people who will do hormones, but the surgical coverage is very scarce around the country. For surgeries? Yay! This person has a resource for you.
And at least at UCLA, they will help cover the cost to travel to Northern California for the surgery.
Thank you. That's great to hear. Thank you. I think that's well put. The AMA is required by internal mandate to provide all recent medical graduates are required by the AMA's LGBTQ caucus to receive 16 hours of LGBT medical training. And what that means in practice is often, here's the things you need to know about working with lesbians. Trans people kill themselves. Good night. We found that the trainings that we work on are almost entirely LGBT focused, that the work that people are learning about trans people is still a pity project, and we commend this organization and all of you here for focusing on the T in LGBT.
All right, so next we're going to show a short video of trans people talking about their experiences.
My biggest insecurity around being trans is not being seen as a, quote, real man.
Will my voice get deep? Will I get facial hair? Will I pass? Will all these things that seemed important to me at the time ever occur?
I was insecure about not being feminine enough.
I had insecurities about having masculine features.
My biggest insecurity is as simple and as deep as walking down the street.
I transitioned while taking public transportation in Chicago every day, and I got very attuned to kind of quietly watching and listening in to all the other passengers to see who was gawking, who was laughing, and who was disgusted, because disgust can often lead to violence, and so you have to always be aware of what everyone is thinking about you.
I think I'm constantly paranoid over my safety.
I've been the victim of a bashing before. Like someone walked up behind me, knocked me to the ground, like sucker punch you from behind. And in my mind I was thinking, what did I do to provoke such, insanity or anger in this person?
Bathroom situations are really complicated and make me feel really insecure. I don't use public bathrooms ever, and I haven't since I was 16.
Sometimes I feel like I'm not trans enough because I can pass as a masculine woman.
I've made a choice to not continue transitioning and to exist someplace in the middle.
I'd say one of my other biggest insecurities is my impact on other people. I'm so terrified that I've hurt my family or I've hurt my friends, that I've ruined certain social networks or certain events that all my friends used to attend together, and my transition is what changed all of that.
So dating brings up a lot of insecurities for me, and I think it's about getting our partners to feel good about their identity.
Can we talk about sex? Yeah. Okay. I noticed that whenever I was dating somebody, I couldn't be as sexually free with them as I would have liked. I felt like I could only give and I couldn't receive. I missed out on a lot of beautiful moments that could have helped me grow.
Unfortunately, I do think that my insecurities around my trans identity will live with me forever. I think the only way that I have learned to deal with it is just to understand that I am a man and I accept myself as a man, and that other people's opinions of me don't really matter.
When I first came out, my biggest coping mechanism for dealing with insecurity was fake it till you make it. I would just walk out of the door with such confidence and such excitement that I put on an air of like I knew exactly what I was doing. Of course, secretly inside I was terrified, but as long as I could put that front up, it seemed to help mitigate some of the unwanted attention coming my way.
When I walk down the street, I still look over my shoulder, but it did not prevent me from continuing walking down the street.
Now, I've really grown to love myself. I love who I am. I love the fact that I have masculine qualities about me. That's what makes me the trans person that I am. For trans people who are insecure about coming out or about their trans identity,
it's okay to be insecure. It's okay to be uncomfortable. It's okay to question yourself in this process.
Befriend your insecurity. Get to know your fears, come to live with them. They become kind of like roommates. You might not love them, but they're there and you just kind of have to come to terms with them.
This time in between that trans people kind of don't feel like they're either here or there, enjoy it. This is the time that when we look deep into ourselves and we work solidly to get right with ourselves, we end up coming out of all of this better human beings.
And I'm quoting my girlfriend. She said, most people cannot get out of bad relationships. They cannot change their jobs. And here we are, we're changing everything about ourselves and saying to the world, look, this is me. Surround yourself with people that validate you and that support you.
The most important thing to focus on is that you're happy and healthy and that you're happy with yourself and that you don't pay attention to what other people think about you, because ultimately they're not in your skin, they're not in your body, and they're not living your life.
make every day a day that is meaningful for you, that feels good to you. Time is moving so quickly. Don't waste it on negative energy and other people's opinion. Find happiness within you.
Alrighty. So we show this video not to feel bad for transgender people or to pity them, but it's important for us to listen to trans people and to try to get an understanding of the experiences that they're going through so that we know how to best support them. And to also recognize how resilient this community is. So I'm going to switch gears and talk a little bit about mental health and transgender identities. And so before I start this, I really wanted to just set the frame that transphobia is what causes mental health problems. Being trans doesn't. And so we know that transgender populations have very high risk for a number of negative mental health outcomes, depression, anxiety, suicide. But this is not because of their trans identity, it's because they live in a society that's unaccepting of their trans identity. I really liked what Kevin Nadal said. This is a way of coping with a society that's unsafe, physically, emotionally, mentally. And so I just want to keep that framework as we go through this. So being transgender is not a mental disorder. And so this is documented by APA. This has been officially stated in the WPATH's Standards of Care, which WPATH is the World Professional Association of Transgender Health. And so they clearly state that being trans or gender nonconforming is a common and normal experience in human diversity, and that it shouldn't be judged as pathological or negative. However, we have to recognize as psychologists our role in the stigma that we have perpetuated about transgender people, and that being transgender is a mental illness. Because it wasn't until 2013, a few years ago, that gender identity disorder was taken out of the DSM. And so it's no wonder that people still think that transgender is a mental disorder. And we still have gender dysphoria, which a lot of people also associate with transgender people and gender nonconforming people having a mental disorder, right? So it's our job as psychologists to actively take a stance against that and against the pathology of trans. So I talked about some of the high risks for this group, and so one of those being that 41% of transgender people have attempted suicide. So this is extremely high number, and actually, so this was from a study of conducted 2008-2009. There's a recent 2015 U.S. transgender survey that surveyed 28,000 transgender adults in the United States. The report just came out. And this number hasn't wavered. 40% is still the suicide attempt rate. And that's not contemplated suicide, that's actually made an attempt. And that's 10 times higher than the overall population. So it's important that we're actively doing things to make the environment more affirming and more supportive so that we can help reduce these mental health risks. And so I show this other figure on the side to show how support matters and how this, the environments that trans people are in matter. And so in a study with transgender youth, those that had no parental support, the suicide attempt rate was over half, 57%. But for those trans youth with supportive parents, that drops down to 4%. So this just goes to show how important support is, and then trans clients coming into our centers, we need to have that supportive, affirming environment to help, so that we're at least not contributing to this and also supporting people. Also in SBTAN, so we have lots of trans youth and very affirming families, and there's many, many well-adjusted, thriving trans youth that I know. So, okay, so I want to talk about some barriers to healthcare, and because of the history that we have stigmatizing and pathologizing transgender people, there's oftentimes fear of discrimination when going into healthcare providers or mental health care providers. In that survey I was talking about, 1 in 3 transgender people had a negative experience at a healthcare provider or mental health care provider. And so it's no wonder that people are avoiding getting the treatment that they need. And so 1 in 4 have actually delayed going out and seeking services, healthcare services, because of fear of discrimination. And 19% have been refused healthcare. Another barrier is that oftentimes trans patients have to educate their doctors or their mental health providers about what transgender means. And so that's a lot of work on them to explain who they are and what that means. So just some examples of some negative experiences that people have had in healthcare fields. So this comes from #TransHealthFail. So there's lots of these real world examples on there. So the first one says, in case you can't read, this doctor then told me that at med school in NYC he would take new students out to sightsee transvestite prostitutes. Next one says, 3 years ago I saw a gender therapist, a cisgender woman, who told me I wasn't trans enough to transition. And then the last one, a nurse tried to call me back to my appointment but then shouted, "That can't be you, this chart says male." Right? And this happens all the time. I've seen it happen in front of my own eyes. A trans student that I knew came in for drop-in hours at a career center. And so what the system is in whatever's registered in the UC system as your name, they yell that out across the room. So for this trans man, his birth name was yelled out, right? So I'm just this is a fake name, but Sarah, do we have a Sarah? And I'm just cringing because I know, right? And then, oh, there she is, she's here, she's over there, right? And so really being aware of using gender neutral language and all those kinds of things really makes a difference. You would understand why that person wouldn't want to come back. Okay, so I want to talk about the role of gatekeeping. So psychologists have long been put in the role of gatekeeper, which means, so what this looks like is in the past there's been requirements for transgender people to have a certain number of sessions of therapy before they can get a letter from their therapist that gives them permission to get the medical care that they need to medically transition. That is no longer legally required. You don't have to go to any certain number of sessions. It's also not legally required to have a letter from a therapist in order to transition. However, insurance companies often require therapists, a letter from a therapist and a diagnosis of gender dysphoria in order to provide coverage for hormone replacement therapy or gender affirmative surgeries. So even though we're trying to move away from this, we're often put in that role. But I want to encourage all of you to distance yourself as much as possible from playing the role of gatekeeper. because there's so many negative effects from this. So first of all, it's not our role to decide whether or not our clients are transgender. That's not our role. We're not gender detectives. Our role is to be validating. Our role is to be supportive of our transgender clients and help them in any way that we can for them to get access to the care that they need. Having a gatekeeping role, it's really going to rupture the therapeutic alliance. All of a sudden you have all this power and you're holding power over whether or not somebody can transition, which could be life or death for them. And so when then we're delaying care that they need to have, and we're also holding this power, and it creates not for a good experience for the client. It can be very disempowering and invalidating of their experience, because they might feel like they're being evaluated. Am I trans enough to get access to hormones, etc.? And one other point is that this leads to an inaccurate assessment of their needs. If you're holding the power of this letter of whether or not they can transition, trans people that know that there's a certain profile that they might have to play up in order to get that letter, right? So what this looks like is heightening the gender dysphoria, heightening how much they hate their bodies, right? If that may or may not be true. And then also lessening any other psychological distress. So no anxiety, no depression, right? So that they meet the right profile in order to get that letter. But then we are actually not getting a really accurate assessment of what's going on for that client. And then we can't really support them in the way that they need. So my advice is to, if somebody needs a letter, to provide a letter for them. Also, you can make this a more empowering experience by writing the letter with your client so that they know what you're putting into that letter, and trying to share that power as much as possible. There's lots of examples of letters online that we can give you access to. Any questions about that? Okay, so, question. Mm-hmm. Right. You bring up a very good point, because there's not lines of cisgender people trying to get hormone replacement therapy. That's not a thing that happens, right? So, but, just to cover it, they want to have some kind of documentation. I don't know. There's another point I was going to make. Oh, and also I feel like generally there's this fear that people are going to regret having surgeries, and that's just a myth. I mean, that's so uncommon. And also research shows that after people have been able to medically transition, psychological distress decreases, suicidality decreases, depression decreases, and quality of life increases. So, yeah, but that's a good point. And so I've heard a couple other speakers talk about this informed consent model versus kind of this gatekeeping role. So clients can go and discuss get informed consent from their medical providers and be very aware of the potential risks or benefits, nature of treatment for either hormones, for other surgeries. And so if a person's in a state where they can give informed consent, then they should be able to have access to that. Okay, so I want to talk about trans competent care, so clinically speaking. And so I'm going to organize this through these 3 different pillars that make up cultural competence. So our values, attitudes, knowledge and understanding, and then also skills. And we're going to provide 3 action steps, okay? So first, values and attitudes. It's really important for all of us to really reflect and understand where our own biases come, our own implicit biases. Thinking about, what did we learn about gender growing up? What did we learn about transgender people? Are there still areas where I need to know more? Are there areas where I feel uncomfortable with this? Let's really be honest with ourselves, because that's going to show in the room with a transgender client. If you don't know how to talk about the word transgender or say the word cisgender without being uncomfortable, clients are going to notice that. So it's really important to have that self-awareness so that you can go out and get that education or go into the community and meet more trans people to work on that. And so, yeah, again, as I said, our own attitudes and knowledge about gender identity, gender expression is really going to affect the quality of care that we can provide for transgender, gender nonconforming clients. Okay, so because we live in a society that teaches us about the gender binary, there might be a lot of assumptions that we might make. And so I'm just going to give some warnings of common assumptions that we make so that you can watch out for those. So one common assumption is that everyone is cisgender. Right? So we don't expect that anybody is transgender. We expect everybody to be cisgender. So a lot of you might have seen trans clients, or you might have seen trans clients and didn't know because you just assumed that they were cisgender. Also, a very pervasive assumption is that people are either male or female. So even if a client expresses you that they're questioning their gender identity or that they're trans, you might assume that they're transitioning into another binary category. So it's important to be open to understand that there's many different gender options. So for example, I had a client who said that they didn't know their gender identity. So it was important for me to not assume this person was assigned female, not assume that, oh, so you think that you're a boy, right? Oh, okay, so what gender options have you considered, and how does this feel to you, right? And so providing that breadth. Another assumption is that we can tell gender by appearance. So we do this all the time, and it's kind of ingrained in our brain, but we have to, as we talked about before, gender identity is internal, and so we can't tell somebody's gender identity by their experience, and we also by their appearance. And we also know that gender expression can also differ from gender identity. Okay, so another thing is that a lot of times when we think about transgender people, there might be a dominant narrative that we have. And so that might be that people always knew that they were transgender from when they were really young, that they hate their bodies, that they want to have a medical transition, and that after they have a medical transition, that everything's going to be happy and okay. And so for some people, that might be the case, but there's many, many different transition paths that people take, and not everybody wants to have a medical transition. So it's important to not assume that that's going to be the process for your client, right? So some people might want to socially transition and not medically transition. Sometimes people want to have a medical transition before they socially transition. Sometimes people want to change their pronouns and not their name. Sometimes people will change their name and pronouns but not their appearance, right? So there's tons and tons of possibilities, and it's just important to be open to that and help your client explore what possibilities feel good for them. And finally, right, so we have this idea or maybe a stereotype that all transgender people have mental health issues and that they're unhappy. And so it's important to also acknowledge that, hey, transgender people can be happy, well-adjusted, and well-functioning, and that we don't need to assume because they're trans that they're going to have all these different problems. Which leads me to my next point, which is pay attention, but not too much. So it's this tricky fine line, right? So how do we understand that mental health concerns may or may not be related to a trans person's identity? So a lot of trans folks, they'll have maybe multiple, they'll have maybe an eating disorder, anxiety, depression, and that could be related to their trans identity. But also, they might be coming in and they're struggling with that, and it's not related to their trans identity. Maybe they just want to come in because they're heartbroken and they want to talk about a breakup. Or they're really nervous about a test and they want to talk about test anxiety. And so if you're bringing up over and over, so how does your trans identity relate to that? That might be like, whoa, I'm just coming in to talk about this, right? And so I think it's important to keep in mind and ask yourself where this is coming from, either avoiding the topic of a trans identity or over attending to the trans identity. Is that pulling you away or towards? Right? So I think sometimes out of our own discomfort, we'll either avoid the subject or talk about it too much. So you got to find that right balance. Okay, so it's also important to gain knowledge and understanding, and so that you can have this lens and some awareness about what transgender people might go through and the prejudice and discrimination. It's important. Oh yeah, question? Right. I see. Yeah, that's a really good question. And if you're going to be in our Let's Talk About It, I would love to do some brainstorming and just get some ideas about how to tackle that issue. But yeah, those kinds of things come up all the time. So thanks for bringing that up. And let's talk more about it. Okay. Okay, so also understanding intersectionality. And so Kevin Nadal talks about a lot of like intersecting identities, and it's important to be aware about how somebody's race, class, sexual orientation, immigration status, disability might be affecting their experience. Also, if you have clients who are transitioning, they might be going through either gaining some privileges or losing privileges and gaining some targeting or some new stereotyped identities. So for example, if a trans woman transitioning might also now start experiencing sexism, right? And then also might be experiencing transphobia. And if this trans woman is attracted to other women, they might be experiencing some homophobia, right, and heterosexism. So it's important to have this intersectional lens, right, and understand how these multiple marginalized identities might affect your clients. Or, 5 minutes, okay. So I'm going to breeze through here, and then also it's important to recognize the institutional barriers. So thinking on your campus, what does housing look like? What do bathrooms look like? What are all these things, and how are they contributing? Are they trans affirming or not? And so one other tip is just that it's important for all of us to educate ourselves. So I commend you for coming to a training and trying to learn more about this topic. And I encourage you to keep talking to other people. Go be engaged with the trans community in your local setting. Meet people, talk about what's going on. But also understand that you're not going to be able to know everything, and that's okay. And really being open to each client's unique experience. So it's okay to ask your client, what does that gender identity mean to you? And to really come from a place of humility, but also have a basic understanding of trans and non-binary identities. Also, you're bound to mess up and make mistakes because we're humans, we're not perfect. But I think what's more important than not making mistakes is how to apologize or thank your client for correcting you, and then just moving forward. Because a lot of times trans people don't get really great apologies or never get apologies at all. And so I think that can make a big difference in repairing your relationship, and it can be a good experience for your client. Should we breeze through these? Okay, so I'm sorry that we don't have more time to spend on these action steps because they're really, really important. But we have 3 main action steps that you can use to take away from this. So number 1 is to show your allyship through using affirming and inclusive demographic forms and signage. So when a trans client is coming into your clinic, they are going to be assessing their safety, right? Because a lot of times people have been mistreated. So if you have signage up with trans flags, you have demographic forms that include assigned sex and multiple gender identities, they're already cluing into, oh, okay, you might understand me and you might be accepting and supportive of me. Also, practicing pronouns. Hopefully we'll get to talk about that a little bit. And also important to ask about pronouns on your form. So there's an example demographic form in there. And this way you're asking everybody, and then you can get it right from the beginning. And then also really, really important to implement gender-inclusive restrooms. And so, should we have? Okay. So like I said, trans people are not going to know that you're an ally unless you identify yourself as an ally, because most people aren't allies to them, okay? Also, a rainbow flag is not enough. A lot of people know a lot about LGB and might be affirming of that, but have no idea about trans, okay? Practicing gender-neutral language can go a long way. So if you think back to the example that I gave about what happened in the waiting room, right? So that can be avoided if you just say, oh, that's students here. Oh, and trying and asking for preferred names. And not, it might be polite to say sir or ma'am, but I get really anxious when people say sir or ma'am because I'm like, how are people reading me? And it might not be correct. When trans people see this, it's just, what the hell? What are you going to do? Right? Like, is it going to be your assigned sex? Is it going to be your actual gender identity? What if your gender identity isn't that? Like, people just want to scribble that out and just spit on it. Like, just, no. Okay, so provided an example in your packet for how you can create better ones. It's a really easy thing to do, so please do it.
Really quickly, how many folks have heard of gender pronouns? How many folks is this brand new? We were kind of socialized to refer to folks in the third person in English with he, him, his, she, her, hers. We know that that's really limiting, and it's also based on what our assumption is about someone's gender, right? We look at someone and we say, oh, he, and we're not really often asking, right? So this idea that they, them, and theirs exist to refer to non-binary people, it's been kind of repurposed by trans folk, especially non-binary folk, to say, please refer to me as they, them, and theirs, right? Z, here, and hers is slightly newer. It was kind of a created terms created by trans folk, kind of as a combo of she and he, Z, right? I don't think it's German, as most folks think, right? But this idea of Z is speaking, I listen to hear, right? That backpack is here's, right? I'm going to the mall with them. They were speaking at the training. They are a staff member, right? So using pronouns is really important, and recognizing that it's because of this gendered way that we see people and the way that we kind of push people into binaries. And so creating options outside of that space is critical. So understanding that we can ask about pronouns, we can put them on our name tags. If I encourage you to write them in if you'd like to, and ask folks, ask your clients, what pronouns do you use? These are my pronouns. This is why that matters to me, right? And so just asking, putting out your own pronouns, putting them on your name badges at something like this, or on your door, or wherever that might be, just to normalize it, putting it in your email signature, and recognizing that if someone doesn't know what that means, you're really creating this space where you're taking the burden off of a trans person from having to explain that over and over, right? Normalizing the checks and recognizing we don't know people's names when we meet them, so why would we know their pronouns? And we would practice with Martha Stewart, so that's just a silly thing that I like to do, is she's a little less political than anyone else. And so, while you have a break later today, talk to a friend or a partner and say, I met this really kooky person named Christine who wants me to talk about Martha Stewart using he, him pronouns, they, them pronouns, Z, here pronouns. Talk about gardening and cooking and spending time in prison, about Martha, using different pronouns. Recognize that your students and your clients may come to you and shift pronouns, may use pronouns differently than you assume or that we're socialized, right? And so you need your tongue to form those words so that when a student comes to you and says, I use Z, here pronouns, you've used it before. And even if that means you refer to your dog or Martha while you're home, or when you're driving home today, talk about Martha in the car, even if it's to yourself. Form those words in your mouth, if that makes sense. And we have a handout in your packet about pronouns, about how to ask, what if you make a mistake, and what to do about pronouns too. And with that, the singular they is a common slip up, but noticing where we already use the singular they as you're driving, oh, they just cut me off, right? We're already doing that in the hypothetical. I want everyone to practice apologizing. I'm sorry, I meant they. Can everyone just say that out loud? I'm sorry. Thank you. That's awesome. That's all you need to say. As Emmy said earlier, instead of saying, oh my gosh, I'm so sorry, I know it's they, I know you, you're creating a spectacle around someone, just saying, I'm sorry, I meant they, and moving on, right? Or checking in with a client later, or thank you for correcting me, I meant they, and moving on, right? And recognizing that it's a cycle that we're gonna keep messing up, and that it's not about a non-apology or a faux apology, and that if we don't change our actions, we're not actually sorry, right? And it's gonna take some practice, and it's gonna take some time. So talk about Martha and get it out of your system, right? Just get that muscle, flex that muscle, and get your pronouns ready for your students, and recognize that it is hard. It's new to us, but you need to change the way you see people. You're not memorizing their pronouns, right? Stop seeing me as a woman. It's not about memorizing that I use they, them, and theirs. It's about seeing me as non-binary. Does that make sense? I am they, them. It's not, oh, I have to automatically correct myself every time. Does that make sense? So changing even the way your mind thinks is critical. Okay. Restrooms? I feel like that's a really good way to end.
That's all we're asking for. Please change the way your mind thinks. Please change the signs on your bathrooms. This is a civil rights issue. It's always been a civil rights issue. We don't get to live and we don't get to be in public if we can't pee in public. If you're out in the world, you need to have access to restrooms. A lot of gender non-conforming people do not have safe access to restrooms. Please change the signs on all the restrooms that you work around, all the restrooms in all the restaurants you visit, all the restrooms everywhere that you are.
And so finally, just know your resources so that you're prepared to help support your clients. And so SBTAN is a really great resource in Santa Barbara area. We have a website with trans affirming providers. We offer support groups for parents of trans youth and young adults. So do that research and find your resources in your local area, and feel free to come and connect with us if you need more resources. Also, be an advocate for your clients. So be aware of the campus laws, policies, so that you can really advocate if your client's being mistreated. And thank you so much.